some of your work was in Minnesota.
Correct.
Was it a colder part of Minnesota?
Very cold part of Minnesota.
you-
It's Minneapolis.
I'm sorry. Did you often see these type of injuries there?
Yes, I mean, we took care of a trauma center, Hennepin County. Very frequently, patients that are drunk fall down on ice sidewalks and could develop, lacerations in their head, epidurals, which are blood clots above the dura because they fracture a bone in the temporal area and they can get a bleed from a fractured artery. And it happens when people are shoveling snow and have a heart attack and fall backwards. So there are various ways that people fall, resulting in head injuries and lacerations to their forehead or to different areas of their head.
Can somebody suffer this type of injury simply by falling backwards?
Absolutely.
You had taken us through the process of falling backwards and then talked about what happens to the brain. Can I ask you a couple detailed questions about that?
Sure.
When you explained that the brain upon impact then shifts forward and hits the front of the skull, is there a medical term for that process?
Well, the medical term is a coup counter coup injury. So the coup is when you first hit. In this case, it was the back of the head, as summarized by the laceration in the back of the head, and the contusions that the pathologist and the ME found in the back of the brain. And then the brain shifts forward, and as it's traveling at a certain velocity, because it's thrust forward on the floor of the base of the skull, it's getting bumped, and it's getting, again, you can think of it as a hammer hitting a thumb. It's getting black and blue in the areas that are sharpest.
Are there symptoms that result of the process coup counter coup?
This is clinically, it varies. I mean, you can go from anywhere from a simple concussion where you sort of are unaware of what happened, but you're still awake, you're confused, all the way to, ultimately being in a coma.
Can this type of injury, the coup counter coup, and what you see in the review of your files, could this type of injury happen from an attack by a weapon, like a bat or a hammer?
Well, he did not have a depressed skull fracture. So any focal hit like that